Assalamualaikum and a very good evening to our lecturer, Dr. Dahlia. So my name is Nur Nadhirah Binti Zaidi, matrix number 193674. I am the representative from Group 1. So today I would like to present our team case study of Parkway Nursing Care. So let me begin with the introduction. So Parkway Nursing Care is an organization that is founded in Phoenix, Arizona. So this institution was established in the year 1972. Aside from providing healthcare facilities, Parkway also offers in-home nursing care. Currently, this organization have 220 facilities with 115 beds in each facilities, and they also employs a total of nearly 30,000 people. However, despite being one of the best care facilities in the region, Parkway encounters several problems. So these problems include increasing work pressure, increased government restriction, and also monitoring. So this external problem has caused Parkway to face difficult situation as they need for increased documentation may cause funding reduction. So, but then the interviews with the employees revealed that there are internal problems within the organization. So the problem that the staff and employees address include the quality of employees being hired to fill positions, the employees' attitude in caregiving, excessive number of patients, patients complaining and demanding, and also the schedule flexibility of the employees. Hence, Parkway need to implement massive changes as employees have voiced out their concerns. Therefore, the problems addressed in this case study will be tackled by looking at the topics such as organizational change and stress management, leadership, motivation, emotions and moods, and also communications. Moving on to our first analysis. The question is, what do the data on employee injuries, incidents, absences, and turnover suggest to you? Is there a reason for concern about the company's direction? So, based on the data observed from the statistic, it indicates the increase in rate of employee injuries, incidents, absenteeism of the employees, as well as turnover rate. The rate of employee injuries is intercorrelated with the incidents. So the incidents here refer to the injuries faced by patients. So these two things is intercorrelated because when number of patients increases, the staff might have too many patients as they may overlook them, thus causing accidents. So when there is accident, the number of injuries faced by nurses also increases. When this happens, there are too many injuries occurs. Hence, it led to an increase of a certified absence per staff. Absenteeism, on the other hand, is linked with physical health of the staff. So when some of the staff are injured, they have no option but to take certified absence. So when all of these problems happens, it resulted in unsatisfied employees' need, stressful work environment, and also job dissatisfaction. So this problem can be viewed from two theory. First is the hierarchy of needs theory. Second is equity theory. So, based on the hierarchy of needs theory, higher level needs cannot be satisfied until lower level needs are satisfied. Unless employees' physiological needs are satisfied, employees would be unsatisfied with their job. Thus, it can be concluded that most of the time they are dissatisfied with the job, but they respond passively by neglecting the job. So that explains why absenteeism worsened, but the turnover rate remained constant. Next, equity theory is a theory that compares the job input and also the outcomes of an individual with others to eliminate any inequities. So, employees often compare the ratio of their outcomes to their input with the ratio of others. When someone has to leave for emergency reasons, to take care of their responsibilities, for example, they often feel guilty because other employees have to work extra hard. However, the other employees perceive inequity because they have to bear others' employee workload. In this case, the nurses feel demotivated as they are having distorted perceptions of self. So, in short, all of the information on the employee's injuries, incidents per patient, and absenteeism, as well as turnover rate, indicate some areas of concern for Parkway nursing care. So this company has to take action to alleviate the concerns before they get out of hand in order to maintain its reputation as one of the best nursing facilities. Moving on to our next analysis, the question is, given the board of directors' desire to re-energize the workforce, what advice would you provide for creating a leadership strategy? What leader behaviors should nursing home directors and nurse supervisors demonstrate? So, this second question is actually about the advice that should be given to Parkway nursing care. But first, we need to know the previous strategy of leadership. Laissez-faire leadership can be defined as the delegative leadership, where the leader allows the group member to solve their own problems. So researchers have found that this type of leadership has led to the lowest productivity within the team members. As an example, the director and the head of nurse did nothing until it becomes too late. So in this case, due to the lack of concerns towards the healthcare staff, it resulted in crises such as the lack of rest by the employee. So when they didn't have enough rest, it leads to undesirable accidents. So, what is the best leadership strategy? The nursing home director and nurse supervisor need to formulate detailed plans, create efficient organizational structure, and also they need to oversee the operation daily. And in order to do that, the important trait that these two positions need to have is consideration. So based on the situational leadership theory, leaders need to give a clear and specific direction if their followers is unable and also unwilling to do the task given to them. However, if the followers are able to do the task but unwilling to do it, leaders should have used supportive and also participative style. What the director and head nurse should do is, they should increase the number of nurses to prevent from overworking between the nurses in that particular shift. Besides that, the delegation of tasks and also processes are made by the employee, in this case, the nurses. However, the supervisor should still get involved. So according to Job Characteristic Model, JCM, autonomy provides a degree to the employee to have freedom. The leadership based on this theory can actually increase the employee involvement in the organization. By allowing the decision to delegate the task by the nurse is an example of participative management, where it explains the joint decision making, which can enhance the motivation, hence creating a dynamic workforce within the organization. So moving on to our next analysis, which is analysis 3. Taking into consideration the issue of communication, analyze the current situation and also provide effective recommendations for Parkway to adopt as their communication strategy. So, the third major problem incurred in the operation of Parkway nursing care is very poor communication. In the status quo of the Parkway internal system, obviously, there exists inconsistency in the lateral communication dimension and also inefficiency in the upward communication direction. Firstly, as what lateral communication is defined, among the same work group staff members, resulting from the lack of time to review the report, the transition of documentation when changing shifts is demonstrated to be unclear and also ineffective. Secondly, the noise in the communication process refers to anything that prevents or hinders the good transmission. The disagreements on tools for documenting the patient outcomes between the different age groups of employees generates the noise, then creates the barrier in the communication process. Thirdly, communication that flows from lower level to higher level is called upward communication. So the voice and the suggestion of employees are being neglected by the leadership management, which indicates the higher up fails to implement their duty of absorbing the feedback from the basic level employees. Next, according to the detected problems of poor communication, the following strategies are recommended to be conducted by the organization and also the employees. In the first place, the concept of channel richness implies the amount of information that can be transmitted during a communication episode. Thus, the groupware or the specialized company application is better communication channel with high information richness than spiral notebooks. It is more convenient for logging the shift report, so by using this way, it will smooth the switching progress. Secondly, establish a small formal group in the form of the combination of the young and also old caregivers for reconciling the documentation approach. The one-to-one small group through persuasive communication from young workers to senior workers can greatly share the perception of the communication method. So it can help the older workers build their confidence on handling the new approach through the help and careful instruction from the young workers. Lastly, considering the upward dimension, it is necessary to construct a department or a section similar to the focus groups mentioned in the case, which is in charge of validly conveying the advice of lower level to the higher level in the organization. So this requires the department to fully play the role of middleman. They have to proactively carry out the employee survey on different issues that will be compiled and analyzed to point out the major and also constructive opinions, and then they have to make sure that the voice is heard and the successful information exchange. They must make sure that the information exchange is successful. So the next analysis is what are the major sources of job stress at Parkway? What does the research on employee stress suggest you should do to help minimize the experience of psychological strain for employees? Create a plan for how to reduce stress among employees. The major job stress faced by the employees in this organization is organizational stress and also personal stress. So organizational stress is often caused by the inefficiency of the management in handling employees' welfare. Employees experience emotional and verbal abuse from patients. The patients are also very demanding and difficult to please, which links to the decreasing of job performance and also satisfaction among employees. Apart from that, although many employees have filed complaints regarding this matter to higher positions, zero actions were taken by the higher ups. Besides that, employees also exposed to physical injuries due to lifting patients. Personal stress, on the other hand, is caused by family issues, financial problems, lack working experience and skills, and also demanding work expectations. So, on analysis 4, it also emphasized on the question how to manage psychological strain. To overcome this problem, stress management is very important to control and to reduce tension that occurs by making changes in both emotional and also physical. So there are two approaches in stress management that should be taken into consideration, which is individual and also organizational. So the first one is individual approach. So as we all know, stress at workplace is inevitable. Thus, it is the employee's responsibility to reduce stress by themselves firsthand. So there are several individual strategies that can be taken to reduce stress level. Firstly, employees should implement relaxation techniques. This can be done by practicing meditation to put your mind at ease. All these employees will definitely get refreshed and also feel good while working after doing their meditation. Next, they should have proper time management. On their holiday, they should set a time for themselves so that they can have proper rest at home. And in the midst of heavy schedule, employees should take 5 minutes break in between to reduce their work tension. The third one is to practice physical exercises. As we all know, health is always an important factor to reduce stress. So when the fitness level of the nurses, of the employees is high, then they will feel more energetic for work. Because of that, physical exercise is required. Last but not least, improve social networks. The nurses should meet well among their colleagues. In this way, they will have more support, especially emotional support from their colleagues during their breakdown at work. So their colleagues would be understanding because they are in the same situation. Moving on to organizational approach. So in this approach, management is in charge because stress is caused by organizational factors. In this case, management has always overlooked the issue of excessive workload handled by employees, causing high stress level. So managers should oversee the tasks and rule demands. Through this approach, this is where the plan should be made to cope with stress issues faced by employees. So the plans include better selection and placement. So based on this plan, the management should hire more employees as they are lacking staff. So management should be more wise in selection and placement of the employees to hinder job stress, as individuals with less experience would probably tend to experience higher stress levels. The employees should be properly placed to each department accordingly so that each department would have sufficient employees to bear the workload. Next is to provide training. So the employees, doesn't matter the old one or the new one, they should have proper training to enhance the individual's self-efficacy. So through training that they have experienced, their work efficiency would be much better, hence the occurrence of injuries to both patients and also employees would be likely reduced. Last but not least is the employee involvement. Employee involvement is very important aspect. In this case, the employee wants their opinion on patient care to be heard, as they are the one who spend more time with the patients. So the employees should be given more opportunity in decision making so that they would have more control and the role stress would be efficiently reduced if they are given the voice to speak out their opinions. So to conclude our case study, all the issues that is faced by the employees and management in the Parkway nursing care can be managed if they imply new strategies. So these strategies include implementing path goal theory, channel research, and also situational leadership theory. So by using all of these theories stated, this would resolve the problem, such as high absenteeism, job stress, and low job satisfaction among the employees. So, number of incidents would be less, and they would be more efficient in handling the patients. So, if the management try to practice great leadership and implement thorough organizational changes, Parkways would continue to triumph for many more years to come. That's all for me. Thank you.